This tutorial provides step-by-step instructions for applying and removing a 3M Ioban 2 Easy Antimicrobial Incised Drape in a sterile environment and is intended for clinicians only. The 3M Ioban 2 Easy Antimicrobial Incised Drapes are indicated for creating a sterile surface at a surgical incision site. Prior to applying or removing the incised drape, consult detailed product indications, limitations, safety information, and instructions contained in the instructions for use provided with the product. After disinfecting the skin with a surgical skin preparation agent, allow the preparation agent to dry completely before applying the incised drape. To remove the Ioban drape from its outer packaging, peel open the pouch. Remove the Ioban drape from the peeled pouch. Remove the paper over wrap while maintaining integrity of the drape. Once the paper over wrap is removed, hold the drape with the printing on the handle facing up and separate the printed handle from the white handle. For best results, a 2% application is recommended. Standing on opposite sides of the patient, person number 1 holds the printed drape handle with the printed side up above the patient's body. Person number 2 separates the printed handle from the white edge liner and pulls the white edge liner evenly away from person number 1. When unfolding the drape, both persons should place hands on the outer corners of the edges. This will keep slight tension on the drape and keep it as wrinkle-free as possible. If only one person is performing the application, hold the inside straight in the middle of each edge with the printed side facing up and pull in opposite directions to unfold and position the drape above the patient. The incised drape will need to be almost completely opened before adhering to the patient's body. Stop unfolding the drape if you start to see the clear film appear on the white edge. Position the drape over the intended incision site and adhere it to the patient using a sterile towel or a gloved hand. Be sure not to stretch the drape when adhering. Press down firmly on the film, first along the intended incision line to ensure good adherence and achieve optimal antimicrobial action. Follow by smoothing the film in place firmly and without tension, working away from the intended incision site to achieve adhesion that is as wrinkle-free as possible. Once the drape has been applied, you may remove the rest of the liner and the printed handle by placing a thumb on any corner of the Ioban drape film and peeling the liner back or tearing the printed handle off. When applying the drape on a knee, bend the knee 30 degrees, then apply drape. To remove the Ioban drape from the incision edges prior to skin closure, pinch the drape film near the edge of the incision to create a crease. Pull up on the crease and gently separate the drape from the skin at the incision edge. Expose up to 1 inch of skin surface along each side of the incision edge and proceed with closing the incision. After skin closure, cover the incision with the wound dressing. To remove the 3M Ioban 2 Easy Antimicrobial Incised Drape, fold the drape with attached linen, if used, back on itself at a 180-degree angle. It is critical to go low and slow, pulling gently and with even tension, especially around the incision. Do not pull up on the drape at a 90-degree angle. Once the 3M Ioban 2 Antimicrobial Incised Drape and attached linens are removed from the patient, separate the drape from the reusable linens. Wetting the fabric drape material will help the incised drape peel away from the linens. Dispose of the incised drape and process the reusable linens as usual. Do not use 3M Ioban 2 antimicrobial incised drapes on patients with known allergy or sensitivity to iodine. Use of iodine-containing products in infants younger than 2 months of age has been associated with thyroid dysfunction. Cardiac defibrillation cannot be performed through incised drapes, as arcing, ineffective defibrillation, or patient injury may occur. Follow proper protocols and guidance to mitigate generation of static within the operating room to reduce the risk of electric shock. As with any medical device, it is important to read and understand the detailed instructions for use and safety information included on the package insert. If you have product questions, please contact your local 3M representative. Call the 3M Healthcare Customer Helpline at 800-228-3957 or visit www.3m.com/medical. 3M offers device training upon request.